Welcome to the Icarus project.
We're delighted to be joined by Dr. Anna Maccagnan from the University of Exeter, who's been working on the cost-benefit analysis in the Icarus project. Hello, Anna.
Hi, Tim. Thank you for giving me the opportunity to discuss my research with you.
It's good to have you with us. So, Anna, tell us a little bit about what you've been doing in the Icarus project.
Well, Icarus is a European project which brings together 18 institutions in Europe and 9 cities. And these cities have proposed a number of measures aiming at reducing carbon emission and pollutant emissions in cities. What I've been doing, I've used some of these case studies to run cost-benefit analysis of some of these measures. So to assess the impacts of these measures, compare cost and benefits, and to assess whether these measures are economically viable.
Thank you, Anna. Can you just take us through how you've placed monetary values on some of the costs and benefits?
Yeah, well, the cost and benefit that we have included in the analysis are financial ones, so like capital cost, operation and maintenance cost, but then we also taken into account like energy savings and avoided operation and maintenance costs from the replaced technologies. And well, given that these are financial costs, we didn't have any issues with them. The intangible impacts that we included were health benefits, and this is central in the analysis, and is based on a health impact assessment model which was developed by our Icarus partners. So we had health benefits, we had carbon savings, and we had, for some of these measures, we had additional impacts such as reduction in noise from active transport measures. We had health benefits from increased walking and cycling, given the promotion of walking, cycling, and use of public transport in cities. We had to value these impacts in monetary values. For example, health impacts that we include in the analysis were change in mortality, cardiac and respiratory hospital admissions, and incidence of chronic bronchitis. So we value changes in these impacts using monetary values. So for example, for mortality, we used the values of a statistical life. For hospital admissions, we looked at the cost of hospital admissions. For incidence of chronic bronchitis, we used the willingness to pay to avoid this condition.
Thank you, Anna. So you've placed a monetary value on life. Is that controversial at all?
Well, of course. I mean, there are moral issues when in placing a monetary value on people's life. For us, our life is priceless, and we give up everything we've got to save our own life or the life of a family member. However, for the policymaker, the resources that are available are not infinite, and they have to make decisions.
So can you give us some insights into the main findings of the work you've been doing?
Yes, we have analyzed 9 measures which belong to 3 main areas, which are energy efficiency in building, active transport measures, and alternative fuel vehicles. And out of these 9 measures, we found that 7 are economically profitable. So for 7 of these 9 measures, the benefits outweigh the costs. These measures are characterized by relevant health benefits. We find that, for example, energy efficiency measures are characterized by very high energy savings, which together with the health impacts, carbon savings, lead to a positive assessment of these policies. Another of the main findings is that active transport measures are the ones with the highest benefits compared to the costs, and this is due to the very high health benefits that people who take up regular walking and cycling enjoy.
Were there any uncertainties at all in your analysis?
Yes, there were several uncertainties which were related to some of the costs and benefits of these measures. So, for example, the cities, in some cases, are only just now implementing these measures, so they couldn't really provide us with actual cost data of these policies. Therefore, we had to rely on secondary data, or we had to look at cost data of similar measures carried out in other cities, for example, in cities in the same region or with the same size, so that they could be comparable to our measures. Costs were the first source of uncertainty. Then we had uncertainty related to the identification of some of the impacts of these measures. So, for example, in the case of active transport measures, we couldn't really measure things like the effect on the road infrastructure, or we could not measure what happens for individuals who take up walking and cycling in terms of parking charges, how these change. And so there are a number of impacts that we missed. And the third source of uncertainties relates to the quantification, the monetary quantification of these impacts, because things like health or noise or change in travel time, they don't have market values, and therefore we have to rely on secondary sources on this. But then all these studies, which are available in the literature, depend a lot on the context, on the peculiarities of the city, of the region which is analyzed. So there is uncertainty here as well.
So how did you deal with uncertainty in your analysis?
We dealt with uncertainty by running sensitivity analysis. So we looked at how our results change when changing the inputs of our analysis by a certain percent. So we changed the value of carbon, the value of health endpoints, our cost by 5, 10, 15%, and we looked at how the overall results changed. However, the results of the sensitivity analysis were quite reassuring, because we found that even if we changed our inputs, the overall assessment of the measures would not change.
So the results are pretty robust.
Yes, exactly.
So Anna, based on your findings, what would you say are the key policy messages?
Our findings showed that health benefits of this measure are quite substantial. And in most cases, these measures are economically profitable, so benefits are higher than the costs. And this is an important message for policymakers. Also, cities are responsible for 75% of carbon emissions, so tailoring environmental policies at the city level is quite appropriate. We wouldn't really make specific policy recommendation, policymakers, as different cities have different peculiarities. So a measure that works particularly well in a city may not work that well in another city. So we would not recommend a specific policy for different cities. But overall, our results showed that environmental policies in city bring high health benefits, and overall they are economically profitable.
Anna Maccagnan, thanks for joining us.
Thank you, Tim.